It has been a little over a week now of the government shutdown, and we have already started to see a lot of big problems coming up, especially now with the many flights delayed across the country. I know there's problems with our military and, getting paid and all that, and even more so that are starting to pop up and starting to happen. Now, at the center of this is healthcare, health insurance, right? The Obamacare, as it was coined, or the Affordable Care Act, as you will, right? Now, what exactly does this mean for your health insurance, for you and your family's health plans going into 2026? The open enrollment is just a couple weeks away, and the deadline to actually extend these once enhanced subsidies are almost up, right? So what can you do? I'm gonna also share with you towards the end 3 tips that you could do if Congress really does not pass the bill to extend the subsidies. So stay tuned to this video. Make sure to leave a like and subscribe to the channel if you want to support me for absolutely free. Now let's get into it. So first of all, I want to clear off some rumors that I saw, especially on Twitter. Twitter's going absolutely insane, or X, whatever you want to call it. The weird identity crisis that app is going through. There has been a picture released of this Anthem plan in Georgia, where on the left is like a $300 a month premium, and on the right is like a $900 a month premium. And they're using it as kind of like a, oh my God, look what's happening. First of all, that's a fake picture, okay? It's clearly 2 different plans at 2 different income levels. I want to start off by saying this right now. It's October 7th. There is no way that anyone has access to unless you work on the inside. And even then, it's too early to really tell what the plans are going to look like for 2026. So if you see anything that's kind of talking about 2026 and looking at the options, it's fake. I'm a broker. There is no such thing, okay? Another thing that you may be reading on articles that's everywhere is the illegal healthcare for immigrants, right? There is no such thing as illegal immigrant healthcare, okay? That is absolutely BS, especially not for the ACA, because as you can see, this is a real application you're looking at. Once you start trying to actually enroll a person that doesn't have an immigration status, it simply does not let you go through the application. There is absolutely no way around this. So the fact that they're saying that illegal immigrants can get healthcare is absolutely false. It is not true. Now, could it pass by? Is there an underground market where people do qualify, they sneak in? Of course, but guess what? It's illegal. The majority are not doing this. Now that we talked about, the rumors, let's talk about what is actually going to happen. Well, of course, the subsidies that were given during COVID by Biden to help people during, the toughest time ever are going to be ending in December 31st, 2025. Now, what that means for you and your premiums is pretty much that they're going to go up. Between 50 to 75% is the estimated price increase, as well as many folks are going to be even paying 100%, so double what you are paying right now. Now, not only that, another big change that's coming back is the ACA Subsidy CLIFF is back. So before, you kind of gradually went down if you were over 400% of the federal poverty level. So this is the chart on the screen. 100% of the federal poverty level is on the left. If you make less than that, you don't qualify, and over 400% of the federal poverty level is on the right. Previously, if you made a little bit over that, it kind of gradually goes down based on 8.5% of your income. Now, if you're over 400% of the federal poverty level starting in 2026, you're going to get completely cut off. So there's going to be no subsidy for those who make too much, which, totally agree with. I think it's fair. There's no reason that we should be subsidizing people who make a ton of money for those who make a little bit of money, right? Completely fair there. But as far as the premiums increasing 50, 75%, double for millions of Americans who are going to lose their coverage because of the price increase, totally not fair. They do need to work around this. Now, they're throwing up ideas in the air. The Democrats, Republicans cannot try to strike a deal here. It's becoming very hard for them. Some ideas that are being thrown around is no subsidies or no enhanced subsidies, at least for new enrollees, which is, it's mixed emotions there. So that means those who already have insurance and had ACA before continue with the enhanced subsidies, and then those who are new enrollees are not going to be able to get those enhanced subsidies. They're going to be paying a higher premium. Now, I could go down this rabbit hole of how I would fix the ACA, right? It's a lot, you know. Obviously, depending on which platform you go, a lot of people support it. The statistics I'm going to throw up on the screen here is that most people are for extending the subsidies, even a lot of Republicans. So it's really a big issue, okay? Now, again, I could go down a rabbit hole of how I would fix it, what I would do, but I'm gonna make a separate video on that because there is a lot you could do. But what exactly can you do right now to prepare for the 2026 year? Again, I'm gonna be showing you 3 tips right now that you could do. So number 1, I would highly suggest the new catastrophic plan. So for 2026, they removed the age limit on the catastrophic plans. So anyone under the age of 65 can actually qualify for these catastrophic plans, which means the lowest premium possible, although you're going to have a higher out-of-pocket cost and a higher deductible. But you get pretty cheap health insurance, right? The most affordable plans are the catastrophic plans. So they made a huge update for these plans just because of this very reason, the extending subsidies. They made these new catastrophic plans for 2026. Now, number 2 here is getting a bronze plan, because a bronze plan is obviously the most affordable option in the marketplace that is not a catastrophic plan, and it's going to have better coverage. You can find $0 deductible bronze plans, right? They're going to have higher copays, of course, and higher out-of-pocket maximums, but it is a bronze plan. You are going to be covered in your worst case scenario. Lastly, what I want to talk about is getting an indemnity plan to kind of have as a little backup. So what an indemnity plan is going to do, it's kind of pay you every time you get hospitalized, pay you per visit, per services you need to get done. So if you really pair an indemnity plan with a bronze or a catastrophic plan, then you have some good complete coverage that kind of matches what you probably already have now, without breaking your wallet, without spending thousands and thousands of dollars in premiums for no reason. So really, I would suggest evaluating your wants and your needs. If you're a really, you know, unhealthy person, you have your certain medical conditions, then really invest in a good plan. If you're someone who really does not go to the doctor too much, then don't try to spend too much money on a plan. Get yourself a catastrophic plan or bronze plans. Now, that is all assuming, of course, that these enhanced subsidies do not get renewed. So my personal and professional opinion is that they will get extended. We're seeing a lot of Republican senators recently kind of changing their views on it, saying that while they don't support it, they do need to extend it. So I do believe that the Republicans will crack first, and they will have to release some sort of extension. It doesn't matter if it's 1 year, 2 year, but they will have to release some sort of extension. That is my professional opinion, okay? So if you watched this video, if you made it this far, if you found this helpful, make sure to leave a like and subscribe to the channel. It supports me a ton, and it's absolutely free. If you have anything to say, leave it in the comments. We'll chat about everything that is happening. Thank you all so much for watching this video. Take care, everybody. Bye-bye.